Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic Med-Ed learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia and the brain, we will discuss what should be done if there are sudden changes in BIS monitoring values. To help provide insight into this topic is Dr. Stephen Bader, Chief of Cardiothoracic Anesthesiology at Heritage Valley Health System in Beaver, Pennsylvania.
So when the BIS monitor suddenly shows me a increased value, you just like any other time that you're going to evaluate what does this BIS number mean for me right now, it's really important that you have a situational awareness of what's going on in the room at that moment. So of course, the first thing when you say, wow, the BIS just suddenly jumped up, the first thing that you should do is assume that it is real, right? So quickly look and say, did my Tiva infusion line just suddenly get disconnected and I'm not delivering anesthetic agent? That's sort of top of most people's mind. So you quickly look and make sure your vaporizer is full. If you're using a gas agent, that the something hasn't become disconnected. That's easy to do. The next thing you say is, well, could this be an artifact? I should quickly look and make sure that something in the room didn't just change, right? So situationally, I look and I say, oh, yeah, they just brought out the bovie and they've really started burning. So if you're going to do a big abdominal surgery and they made skin incision and now they're really burning through all those fat layers and there's just a ton of bovie, okay, it makes sense that would suddenly raise my BIS value. So I don't get too panicked about it and I increase my anesthetic depth, using my agents to make sure that it's appropriate for the surgical stimulus and that it's not just artifact from an electrical device like the bovie. It's actually appropriate. Oh, I see they just did something really stimulating, so I'll increase my anesthetic agent. Whereas if I think, oh no, they just turned on that electrical blower fan there, they're using the suction bovie that has the smoke sucker, you're going to have, obvious reason that you had this sudden rise that really doesn't require you to increase the anesthetic agent. Something else could have happened. You could have, any of the aforementioned pitfalls in having, is the patient having a seizure, right? Did I have a sedation procedure going on and we gave a whole bunch of local anesthetic and now it has reached its peak plasma concentration and the patient's having a seizure, right? So that could happen, whether they, show clinical signs of it or not. So there's all these odd artifactual things that you have to immediately eliminate. But the first thing to do is look at what's going on around you and does this number going up make sense for what's going on? So assessing the current level of surgical stimulation, am I delivering the anesthetic agent as I believe I am? Is it disconnected or not? And then do I just need to give some pain medicine right now because it's appropriate for the change in the level of surgical stimulation? So I think that the EMG artifact, the patient muscle relaxant has started wearing off under a general anesthetic is a really common reason for this. The BIS has just sort of popped up unexpectedly, and it's because your muscle relaxant has worn off. You can see that with any clinical situation happening. So then what do I do if I have a sudden drop in my BIS value? Well, it's always the same game. Correlate to the clinical situation. Make sure that you know what's going on with the patient at that moment. So did I give a bolus of something earlier and I had the IV line turned down so it was still sitting in the line, and then I open it up because I want to give the patient more fluids, resulting in a bolus of drugs that I thought I had given 10 minutes earlier, but now I'm just giving it now. That's a unfortunately a really common thing. Maybe you gave that slow onset pain medicine, morphine or Dilaudid, and you now are seeing the effect 10 minutes later. I frequently see this when we bolus the epidural that we've placed for thoracic surgery. So we put an epidural in, we put the patient to sleep. Now we've got them on their side. I dose the epidural right as they're getting the surgery started, but it really takes 15 or 20 minutes for its potent analgesic effect to happen. And you see the sudden drop in the BIS and the hemodynamic parameters. And you really have to assess, like, is that just, some other problem, or is it just my epidural starting to work? So people forget, they bolused the epidural 15 minutes earlier. Now you suddenly see this drop 15 or 20 minutes later and all your parameters. So there's all those little clinical scenarios that you can think of. Always think to yourself, did I give more muscle relaxant? And that has lowered my BIS. The EMG artifact raising effect on the BIS, and then you give muscle relaxant and it decreases the BIS. As much as we hate it when we see a muscle relaxant that has no effect on your hypnotic state lower the BIS, as long as you know that that's part of how the device algorithm works, it's perfectly sensible to take that into account. And there's a funny phenomenon that I have had people ask me about. When we emerge from anesthesia, we're lightening the patient up at the end of the case, very little or no stimulation to the patient as they're putting on the dressings. And then you've been turning down the anesthetic agent, turning it down, getting close to the end. And instead of the number, and it's been gradually rising your BIS, and now you suddenly see it drop. We call this paradoxical emergence pattern in the BIS, or paradoxical emergence decrease in the BIS. We don't really understand why that happens, to be honest. It's well documented in other brain monitoring methodologies too, that this is a strange thing that can happen. Maybe it's got something to do with the physiology of the brain, different parts of the brain waking up at different speeds. Who knows, really, not been well explained. But be aware of that phenomenon as a strange reason that the BIS briefly drops during emergence, even though you're lightening the patient and expecting them to awaken. Obviously, a profound drop in the BIS that doesn't seem to match up with our anesthetic. You have to think of other reasons that the brain is not getting enough blood flow or oxygen. So do we have some other physiologic thing happening? It's a cardiac output suddenly dropped, and we haven't yet cycled the blood pressure cuff, but the BIS is showing us a change before we've gotten around to checking our next set of non-invasive vital signs. So there are other things that can cause the BIS to profoundly drop besides our anesthetic agents.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.